Hello and welcome to the Safety and Quality Education Program podcast. Developed by Metro North Health Safety and Quality in partnership with the Clinical Skills Development Service. Metro North Health acknowledges the traditional custodians of the land upon we live, work and walk, and pay our respects to elders past, present and emerging. The Safety and Quality Education Program has been designed with a focus on patient safety improvement. Each episode will explore ideas and stories in making our care delivery safer for our patients through the implementation of short notice accreditation. Our host is Dr. Mia McLanders, who is the Manager of Research at Clinical Skills Development Service. Mia is an applied researcher with a background in human factors and cognitive psychology. Joining Mia on this episode from Metro North Health is Natasha White and Tracy Grant. Natasha White is a Manager of Systems and Performance in Aboriginal and Torres Strait Islander Leadership Team at Metro North Health. Tracy Grant is the Manager of Aboriginal and Torres Strait Islander Health Services at Metro North. In this episode, our guests explore how clinicians and healthcare workers can demonstrate meeting or exceeding ACHS standards for Aboriginal and Torres Strait Islander people.
Before I'd like to start, I'd like to acknowledge the traditional owners of the land there which we are recording on today, Turrbal country. I'm not from this country, so it's important for me to acknowledge that. My name is Natasha White. I'm a Aboriginal woman from my country is Durrumbal, from my grandmother's side. That's in central Queensland, like Rockhampton area. And then on my grandfather's side, I'm Eamon, which is out in covers the Taroom and Miles kind of area, and then Gungaloo, which is around the Blackwater Bluff region. So I like to call myself a true Central Queenslander. Kind of cover all areas with my mob. So a bit about my work history. I started as an Aboriginal and Torres Strait Islander health worker, generalist, in Yeppoon, Central Queensland. And probably about 2009, so I've been in health for maybe 13, 14 years, and really moved down to Brisbane for, I guess, to get some more job opportunities and career opportunities, because at that time there wasn't a lot, so times have changed. And now I've been with Metro North for, I'd say, just over 8 to 9 years. Yeah.
Wonderful.
Yeah.
Mm. Tracy, would you like to
introduce
yourself?
I too would like to acknowledge the traditional owners of the land on which we're having our podcasts and pay my respects to elders past, present and emerging. I am an Aboriginal and Torres Strait Islander woman. On my mum's side, the Aboriginal side, I have connections to Birigubba and Yidinji, which is way up in the far north, the rainforest people. And I also have bloodline connections to the Torres Strait, Boigu, Bardu and Thursday Island. So I feel I've been blessed with both cultures. And I've been in health, with Queensland Health, for just over 20 years. I too started off as an Aboriginal and Torres Strait Islander health worker up north in a little rural and remote community of about 200 people. I worked there for about 3 years and made my way down the coast, did a stint in Townsville and then came down here to Metro North, and again for job opportunities. And as going from a health worker, working in various roles, had an opportunity along the way, and feel that those positions that I had been fortunate enough to act in, be in, gave me the skills to be in a position where I am today out at Caboolture. Yeah.
That's
and
wonderful.
Enjoy it.
That's great.
Thank you.
So can you tell me, I'll start with you, Tash. Can you tell me how you think the accreditation process directly benefits Aboriginal and Torres Strait Islander patients and their families?
I think one of the major things is the systems approach. when it comes to improving health for Aboriginal and Torres Strait people, it needs to happen from a system-wide approach. I guess that's how people go by rules and regulations, and accreditation is that. So to really improve health for our mob, there needs to be rules put in place for people to really go by them and implement them. We've found that because we've kind of been around before accreditation, before the 6 standards actually come into effect. It was a part of the process of the national, the national facilitation around the having the 6 standards in the accreditation, and I guess from having the 6 standards highly visible, you can see the difference and the change of having being a part of accreditation processes to now where we're not an afterthought in the accreditation process. So I guess for me it's around the system that's put in place that allows us to be front and centre of people's thought process.
That's a great point.
Yeah.
And Tracy, what are your thoughts around being front and centre? Does that really make a difference to the outcomes for Aboriginal Torres Strait Islander peoples?
Most definitely. And being in health from, like for me, what I've seen on my journey, working in health, not knowing anything about safety and quality, and like I said, in positions that I've learnt to see how the organisation works through the safety and quality lens, and how important it is now that we have Aboriginal and Torres Strait Islander people up in positions who are able to influence the change of the system and the process, so that on the other side of the wall, where services are being delivered to Aboriginal and Torres Strait Islander people, it should be done in that culturally appropriate manner, so that our people can feel safe when they come in for healthcare. So having that strong system and process behind the scenes allows that frontline service to happen.
How do you think we're doing, Tracy?
I think we're doing a lot better than we were, say, 20 years ago. And now that we have these 6 cultural standards in place, that helps also to support the system and process for Aboriginal and Torres Strait Islander people. Yeah.
I would say there's definitely still challenges and barriers, but I guess sometimes that, from what I've seen, it comes down to individuals and the way that the standards are actually interpreted is very different, and we've seen that over time, how people interpret the same the same standard in different ways.
Okay.
Yeah.
Tell me a little bit more about that, Tash. The interpretation of the standard matters in terms of delivery of care?
Yeah. I think some people will read it and say, well, this is what it says. And then some people will read it and say, well, this is what it means. But from their own lens and their own perspective. And part of the process that we really miss when it comes to what is the action that we're going to put in place when it comes to the specific standard is the co-design process and the process that needs to happen with Aboriginal and Torres Strait people, because they're the ones that the service is required for and the standards are made about. So we kind of miss that, I think, sometimes from a safety and quality perspective. When we're doing action plans around how we're going to meet, the standard around Indigenous identification. There's no collective response. Everybody goes off and does their individual work around that. So I think there is a gap and a challenge around how we as a system work collectively to put things in place.
Is that a function of siloing, or is it just a breakdown in communication, or just when you say it's sort of fragmented approach, what do you mean by that?
It could be me. It could be around the silo, the siloing, but it also could be just a lack of understanding. And at the forefront is someone who doesn't have a lived experience or that background of working, particularly in Aboriginal and Torres Strait Islander health, or an understanding of why that standard is there in the first place. They could put their own interpretation on that. So the outcome of that may be very different to what's actually required in that space. Does that make sense?
Yeah, it does.
Yeah.
That's interesting.
Yeah.
And in terms of the co-design process that you mentioned, Tracy, I'll throw to you. What have you seen done well in terms of co-design with Aboriginal and Torres Strait Islander people?
Involving our traditional owners and our elders and our community, and also acknowledging that the Aboriginal and Torres Strait Islander workforce in Metro North are a part of that community. So, we still are able to contribute either as a staff member or as a community member, which is really important. And just adding on to what Tash was saying earlier on, processes and the systems needs to be simple. If we make systems or processes hard to access anything, that creates a barrier for Aboriginal and Torres Strait Islander people to access healthcare.
If there were like a simple, if there was one thing, a simple thing that you could see we could do better right now, what would it be?
Ask the simple question how we can do better to be able to have Aboriginal and Torres Strait Islander people feel safe, not just in the building itself, but also to feel safe, to be able to know that they are going to get the healthcare that they need, but also to understand it so that they are able to make decisions to be in charge of their health needs.
Is there anything immediate that's coming to mind in terms of practical things we could be doing differently?
Talking simple language, and being mindful of body language, eye contact, the tone of your voice, and just being respectful. Yeah.
How do I be more respectful with my eye contact and tone of voice?
By building a rapport with the patient, sitting down, getting to know them, getting to know who they are, where they're from, and what their story is, which can make a really big impact on their experience on their journey in hospital.
Very good. Tash?
I think the biggest thing in terms of healthcare is ACHS. One of the biggest things that we find is that, yes, we understand clinicians are busy and they've got a big patient load, but just ACHS. Don't ever assume that, you're following a cultural protocol, because our communities are so diverse and very different, and we receive treatment and care differently. So I would be very different to Tracy when I go to a hospital setting. So I think the fundamental thing is to ask and check in continuously. I think the biggest thing is when we as a community, the reason why I guess that we connect with our patients so well is because we understand, but we also never assume that we fully understand what they're going through. We help them through what it is that they need from us. So yeah, I would say the biggest thing is just to ask.
I feel that the biggest barrier for people who are not of Aboriginal Torres Strait Islander descent is the not knowing what to say, not knowing how to get it right, not knowing if we're getting it wrong. So I think I think that's great advice, because sometimes that fear of not knowing prevents people from actually saying, "Look, I don't know. Can you please teach me what the most respectful way to engage with you would be in this situation?"
Yeah. And Tracy's got some really great, awesome examples around from her previous role at STARS, how as a facility, the staff come together to make a patient feel safe and comfortable. And I guess that was probably one, is they asked her what she needed, and then Tracy in her position facilitated that with the rest of the clinical staff.
That's awesome. Can you tell me about it, Tracy?
Yeah, and every time I think about that story, I think about, it's just about being a human caring for another human. It's human. I see it as human caring. And it was a patient that came in. I had I've never met this lady before. And it was around women's business, and she felt safe sharing with me, what her journey or her story was. And she said to me, "Oh, you know what, I don't feel comfortable. I think I'm going to leave." So my biggest concern was her leaving and then her health deteriorating, getting worse. So when you're put on the spot like this, you've got to think outside the square, because her safety and her experience, I wanted it to be positive. So it was hearing her story and then talking with the team, the team that was going to provide care, and around women's business, not having a male involved. So I spoke to the staff about the importance of her not leaving, but also making sure that she stays here to have the necessary procedure that she needed to have done. The nursing staff were able to cater to that need. But the one change that we couldn't make was the surgeon. He was a male. And she did not understand what her procedure was about. And I said to her, how about I sit in here with you, we'll pull the curtains across, we'll sit on the bed together, I'll hold your hand so that you feel safe, so that he can then explain what he needs to do. You'll never need to look at him, and he will not look at you. She felt safe with that. And so get ready to take her into the theatre, and she said, "I've got one more request." She said, "Can Tracy hold my hand while I'm having my procedure done?"
Oh, my goodness.
And I looked at the team and they said, "Here, get these scrubs on." And I thought, wow, I wasn't expecting this coming into work and wearing scrubs. So they were able to make that happen, because she wanted me to hold her hand and she wanted to see my face when she opened her eyes. And we were able to meet her needs.
Mm.
And she went to another facility a couple of months later, rang me up and asked if I could come and provide support at another facility.
That's extraordinary, Tracy.
Yes.
What a gift to give to somebody, and the difference in her health outcomes had you not been there. That's kind of scary, isn't it, to think through?
It is, yeah. And I just felt that I just needed to make her feel safe. And it was just one human caring for another human. Yeah.
That's beautiful. Thank you for sharing that.
Thank you.
Yeah. Okay, I got a little teary.
Sorry.
I did. I got goosebumps. It was just, that's really special.
I
It's
guess
very,
one
very
of the
special.
biggest things is that's a really great, that's a beautiful example. That occurs more than people know when it comes to our Indigenous hospital liaisons, our Aboriginal health workers. That is part of, we talk about our, when clinical staff go above and beyond. We have health workers and IHLOs that go above and beyond on a regular basis to make sure that our community feels safe and understand their treatment. And it's not just within their job. So, Tracy's example was really great in terms of how the hospital facility come together and she could work with the clinicians and clinicians' mindset changing and how they can come together to make that change. But we also have other staff. We have staff who do it on their own regularly, who don't get the acknowledgement or aren't seen because people don't see that side of, you know, what it takes to make sure someone stays to complete treatment. Yeah.
Do you think through the accreditation process that those kinds of above and beyond behaviours would become apparent?
I think the one thing with with mob when we're at work in the workforce is that we, I suppose, don't like the spotlight put on us when we're providing that care, because that's us doing what we do. Yeah.
Being a good human. So that's not something that's necessarily going to be observable by others.
And it's why if you ask, I would say 100% of the people that work here don't just work here just for the pay. Like a lot of them, most of them will say that they work here because they want to improve health for their mob. So, you know, people, and our communities are small. So that Murray grapevine is so important with our community, because if someone gets, you know, that treatment that they don't like in a facility, then that impacts their family and their community that they're from as well.
Do we miss that in accreditation? Do we capture it even? Is it possible to capture that? I heard from you before, no. So that's okay. So then what does accreditation, how does accreditation benefit you, your community? That's really what I'm asking.
For me, it's about having a voice. Like we have committees for all of these standards, and for me, it's about ensuring that we have a representative that sits in those committees to be able to, especially when it comes to like the 6 cultural actions against those 3 standards. And it's having that representative sit at the table to be the voice, not just for the system and the process, but also to be the voice for Aboriginal and Torres Strait Islander people when they're accessing healthcare. And it might be just a little passing comment that, you know, a patient might provide, you know, some feedback. And it's those little opportunistic comments that can actually make a really big difference on how we can influence change and improve access, improve the experience for our mob when they're coming into hospital.
Yeah.
Anything to add to that, Tash?
I think over time we've gotten better at, as a workforce, to use, say, the accreditation, the standards as a tool for us to be able to get, you know, initiatives or priorities across that we may need to improve health for our mob. So we find that making sure that we align actions to the accreditation standards opens people's eyes or provides more exposure to why we need to deliver Indigenous identification training. You know, why, and the processes that go with that around evaluation before we develop the program. How we improve. How do we use our compliments and complaints system to as a, you know, it's a standard within the accreditation to improve health services based on feedback that our community are providing us. Look, we know that you know, a lot of our community are quite reluctant to provide feedback, good or bad, but there's a reason for that. And part of one reason may be that they've provided feedback numerous times and nothing's ever happened. So for us, it's about using those mechanisms and tools to improve the system. So don't wait for, you know, 3 different people to complain about the same thing to get to 20 for then decide that we've got to make a change. You know, use the 3 people and look at how we put the quality cycle in place to improve. I think for me the biggest thing is using the tool to improve the systems, the governance, the clinical governance, the capability of staff, the environment for our community. We have culture capability framework, which we all work off, and that's been around for quite some time. But being able to leverage culture capability with the accreditation standards has allowed people to, the broader workforce to do things differently. You go to our facilities now and you've got Aboriginal and Torres Strait Islander artwork. Each one have their own visual identity. You've got acknowledgements on the walls. And they're all from people wanting to meet the accreditation standards.
What's it like walking into a clinical environment, Tracy, that is welcoming compared to, say, one that isn't so welcoming?
I'll use myself as an example. Like when I've had to come into like the hospital, it's seeing posters up on the wall, having access to an Aboriginal or Torres Strait Islander worker. For me, it's about seeing if there is a face that I can connect with for safety, because safety for me is very, very important, because we come into such a really big sterile building and it's like the land of the unknown. So for me, I like to know what's going to happen, why it's going to happen, and what are some of the side effects or effects that if I don't have it. And for me, I like if I can't understand the language that the clinician or the doctor is talking about, then I'll ask them to draw a picture. So for me, it's about I like to feel safe, and if I need that, then I want to make sure that it is a safe place for any Aboriginal and Torres Strait Islander person to come in. And while we acknowledge our traditional owners, we also need to create a safe space for our Torres Strait Islander people who also access the service. So for me, it's about making sure that the environment is representing Aboriginal and Torres Strait Islander culture, so that they feel a sense of connection when they come into this space.
And how would we do that?
Having yarns once again with the community, yarning circle, yarning table, and doing cultural audits, and making sure that we have a true representation of the community that we're wanting to meet the needs of. And through the yarning, that's where we get to learn about where we can access artwork, artefacts, what is appropriate, what is not appropriate, and then keep monitoring that, but always striving to improve, to make our healthcare space welcoming for Aboriginal and Torres Strait Islander people. Because just because we have something set up there doesn't mean that we can't do better. We should always strive to improve, and the only way we can do that is continue the yarns with our community.
That's awesome. Tash, do you have anything to add to that? In terms of what it's like for you walking into, because you're a health consumer as well, and what it's like to walk into an environment that's welcoming versus unwelcoming?
I think the unwelcoming is very overwhelming, and the lack of communication and unknown can make you very anxious. And for me, I haven't had too many examples of being a consumer, but I have been with one of my aunties when she was in hospital, and just watching her go through the lack of communication. She was doing. She had a bypass. And, nurses just coming in and not speaking to her really, just checking her obs. And then doctors coming and going, and, she's not from here, so she was very anxious to get home as well. And she basically told them that if they didn't sort out what they needed to do, that she was walking because she wanted to go home. So she potentially could have been discharged against medical advice. But at that time, what I was observing was just communication. We didn't know who the next nurse was, so the nurses didn't do a changeover at the bed. The doctor didn't. We weren't too sure when the doctor was coming back and forward. She received her medication. We then figured out that she could stay the night, didn't have to stay in hospital, but she could stay the night and fly back the next day. Before she left, they did say that they were concerned about her heart rate. But when we sat there, we just explained to the doctor that we'd just been sitting next to a man who had just received some really bad news. So that played on her heart recovery as well, because that made her more anxious and sad, because they basically told him that he wasn't going to live, and that was in the bed next to us, with just the curtain across, So I think it's just been to make it more safe is just communicate. As normal human beings, that's what we want. Communication and clarity. I think and just being kind, like living the values of the organisation, just being kind. Emergencies going to emergency can be even more daunting. And when you're told to get your name and then go and sit down and then someone will come out eventually, like people can become quite anxious around what's going to happen next. So I think it's how do we I think the biggest thing is if we get it right for Aboriginal and Torres Strait Islander people, we get it right for everybody. Because the way we look after our community and treat our community is based off respect, relationships, and culture.
Yeah. And it's about how would you want your family to be treated? Yeah.
I think that's the biggest thing, because we're, Tracy and I both said we're not from here. A lot of people from my community go to Prince Charles or get flown, and mostly flown from Prince Charles as well as Royal Brisbane. So I know that that's very scary. Even they're very quite well known for their health, but that's still very scary experiences. And to know that you've got staff, particularly IHLOs and health workers up there, that will treat them with dignity and like they are family, that's comforting. Yeah.
What do you see as necessary with regard to changing governance to ensure that we do close the gap for Aboriginal and Torres Strait Islander peoples?
For me, it's about yarning. It's yarning and understanding what Aboriginal and Torres Strait Islander culture means to Aboriginal and Torres Strait Islander people, so that we have policies and procedures, and in the policies and procedures there's always a section that says Aboriginal and Torres Strait Islander considerations. And for me, understanding what our culture means to us makes sense for that paragraph that's in our policies and procedures. So if you understand our culture, then we should not even have that in there in the policies and procedures to be considerate, because we should be just treated like everybody else in the health system. With respect. Yeah.
I would say for us to actually achieve the health outcomes, as a system, we need to be innovative, be flexible, and work together at all levels, because we can't, Tracy and I, in positions like ours, we can't do it alone. And historically, we have, and that really is a Band-Aid solution. We need to actually be developing the foundations. We've only got 10 years.
That's right.
10 years for the 2033, when we're supposed to close the gap by. So it needs, I guess, that massive collaboration, and people to understand that Aboriginal and Torres Strait Islander health is everybody's business, and it's not just the Aboriginal and Torres Strait Islander health roles for us to improve health of Aboriginal and Torres Strait Islander people. It's every individual within their position to do so. Yep. In terms of governance, I think governance helps in keeping us on track and narrow. So narrow, that's not it. Keep us on track with achieving those, and I guess keep having the system keeping us accountable to really making a true impact, and not just, our history is that people report to really or do things to tick a box. We want to get away from that. We want to make an impact and real change.
Because to build a cultural capable organisation, we need to understand the history, like what happened before, and today we need to put a plan together on how we're going to move forward for a better tomorrow, and we can only do that together.
Yep. That's beautiful. Thank you. When you were talking before about that, there was a word you used, Tracy, about coming into the building and being off country, but it was like you're in a sterile environment, and it's that disconnect from country literally as well. It's sort of that extra element to it that makes it makes sense to me, because from my background in psychology, understanding as a trauma being, one of the ways that we manage trauma is to sort of connect and ground, and as I understand it, that connection to country and the actual physical natural environment is part of that grounding and soothing. So then to even just be in a physically clinical environment is really disconnecting and disorientating and destabilizing.
Very much. And then you're in a ward with people you never met before. Your comfort is your home and safety. And we've had patients who have moved themselves to different wards on levels just because there were other Aboriginal and Torres Strait Islander people there, and that's where they felt safe. So they moved themselves.
Yeah, but it makes so much sense because of that connection, and
I think we and one of the things I really like what Trace talks about is we just need to make it simple. Health is not complex. We as a people are not complex. Simple things work for us, and it could be the simplest thing is how we change our letterheads when we send out appointment letters to our community.
Change in what way?
Colour. Putting artwork on them.
Artwork, like cultural artwork.
So they're not seen as being come from government. We, offering support to the family as well as not just the consumer. We have services here at Royal Brisbane and Prince Charles where they collect, the IHLOs will collect patients from the airport, bring them to the appointment to the hospital. PTSS is a big issue. So, they help navigate getting them into accommodation that we can afford. So we often forget the social determinants and the cultural determinants and how that impacts healthcare. We only always worry about what we're treating. And for us, particularly being Aboriginal and Torres Strait Islander health workers, the fundamental learnings from that is, Aboriginal and Torres Strait Islander health, it's around holistic care. So how we treat that whole person as well as, their supporting networks.
The big picture behind them. Yeah.
Yeah.
And even with talking about the welcoming environment, we have a lot of artwork across Metro North. Each facility has their own artwork which tells a story. And we have a lot of beautiful shirts that have the artwork, like our identification shirts, our own facility shirts. And it's important when staff are wearing those shirts, especially the non-Aboriginal and Torres Strait Islander staff, to actually understand and know what that story tells. Because when our mobs see a staff member with that shirt on, they're actually displaying or showing that, you can come to me and feel safe. But if they get questioned or asked about that artwork and they don't know, then that there can be like red flags, I suppose. So it's just little simple things like that. You don't need to know the real intimate details of the artwork, but to have knowledge, and that's having knowledge of culture.
And I think the biggest thing is cultural safety. We talk about cultural safety. Cultural safety is not about us educating. It's about the individual going out and educating themselves to be able to become more culturally safe and culturally aware. There's a lot of conversations that occur around, providing education programs and toolkits for people. But ultimately, the foundation of cultural safety is about people taking that initiative to go and educate themselves.
And putting it into practice.
Yep.
Yeah.